It is estimated that up to half of all adult mental health disorders will have emerged by adolescence, with 1 in 7 Australians aged 4 to 17 years meeting the threshold for a clinical mental health diagnosis. This brings us to the age-old question and our first episode in education titled, Well, whose responsibility is it? In this podcast, I aim to answer this question, or at least dibble-dabble in discourse surrounding this contemporary issue. If you are a teacher, parent, or pre-service teacher, then this podcast may be for you. The statistics mentioned before has given huge insight to our government to respond and partially take accountability in the age-old question of whose responsibility is it? Mental health as a political and social agenda has encouraged the Australian government to expand its investment in mental health-related services over the past 3 decades. We have seen a funding increase from $2.9 billion in 1992 and 93 to $11 billion in 2020, and real per capita expenditure increasing from $163 to $431 over the same period. Although funding has increased to address this mental health gap, and emerging statistics suggest that the increase in expenditure in mental health treatment is not equating to a reduction in mental health. In particular, COVID did not help this at all. So why is mental health expenditure of relevance for our students across Australia? Well, this means we must look inwards to the barriers surrounding mental health access. We have to seek to understand past and emerging patterns of our families, with particular attention to the past 2 decades. An incline in recognition of the needs and experience of children of parents with mental illness has grown. And to be honest, since COVID, we are more open to a discourse surrounding mental health. It is estimated that 21 to 24% of Australian children live in a household where at least one parent has a mental illness. For these children, the caregiving role that they undertake may be more than just helping out the house. Core attachment needs such as love, emotional nurturing, and security are at risk for students whose families' lived experience of mental health are problematic within the family dynamic. For this reason, children who have taken on the unprecedented role of caregiver have had to deal with a range of varying emotions and may be affected in a number of ways. These can include fear, questions about normality, and disrupted or fragmented relationships. One of the points of tension in relationships amongst families and consumers is the need to be treated with respect and listened to. The complexity and variability of mental illness within households suggests that children must also feel the right to be accepted, valued, and heard within their own homes, but even more so in their classrooms. In light of this, we must understand the importance of understanding others' realities and promoting respectful relationships. Within a school setting, the importance of relationships is fundamental in addressing secondary complex needs of our students. Teachers essentially are at the forefront of being agents of change for the same goal of allowing students to regulate their emotions in a predictable environment. Strategies to ensure regulation should also involve families so that opportunities in decision-making are not limited to the educators, but involve a collaborative effort between stakeholders. Building supportive relationships with family members is at the core of education, and developing and sustaining these relationships over time impacts the social and emotional well-being of both our parents and students. There is a large portion of evidence that indicates that despite good intentions of policymakers in Australia, many families continue to experience difficulties in relationships with service providers. So why is that? Well, a hesitancy to access outreach services is prevalent in school settings, whether it is for fear of judgment or ignorance. Submissions from individuals and family groups stress that the exclusion of families from treatment services as the interpretation of confidentiality and privacy remains contentious. When shame coupled with a fear of being judged prevents our families from reaching out, we need to respond to our families with compassion and empathy, but also truth-telling and listening, a skill we don't often gain from a job per se, but a trait that we need to work on every day. Why is it important to allocate funding towards effective mental health practices in our schools? In order to respond to the systemic and structural barriers, schools too often find themselves in the position of having to divert funds to facilitate school-based mental health support for students who would otherwise be unlikely to be able to access specialist care. These treatment services, while important, are not allocated appropriately, meaning there's more pressure on teachers to facilitate and accommodate mental health within the classroom. To enable teachers to play a substantial role in supporting the mental health of students, it is imperative that clear and succinct guidelines surrounding mental health training for teaching staff is available, as well as improved access to mental health professionals and resources. If teachers are not given access to mental health professionals to better understand their students, then they will use their own toolbox or perceived interactions of mental health to deal with difficult situations. For instance, traditionally in the education system, requiring students to obey rules out of fear of punishment was a corporal way of dealing with problematic behaviour, although now we know that this reduces student self-regulation. Too often, this is still seen as a way to modify behaviour within the classroom and produces a reactive response as opposed to one that tends to meet the needs of well-being. It's widely known as best practice that students can become capable in matters affecting them when a strong sense of classroom culture promotes their feelings of control and autonomy. Undoubtedly, the more students are given responsibility for regulating their own behaviour, the more socially competent beings they can become. Such autonomy is also asserted by theorists, who explain power and responsibility are compatible, meaning that when educators place students in positions of low power, those times when power is wielded over them in order to coerce compliance, students hold little ownership over their actions, therefore projecting a lack of investment in the consequences of their actions. In a study titled Barriers to Supporting Children's Mental Health in Australian Primary Schools, Perspectives of School Staff, Mental Health and Prevention, found that primary school staff are under increasing pressure to identify and manage children with emerging and existing mental health symptoms. This may be due to the recognised lack of community-based mental health clinicians servicing Australian primary schools, as well as poor linkages between these services and the schools. In developed countries, the association between low socioeconomic status and mental health problems is strong and significant. Studies have shown that people in the lowest economic strata are roughly 2.5 times more likely than those in the higher strata to have a mental illness. For people living in deprived circumstances, there is a high correlation between common mental health problems and poor community resources and connections. Again, how do we address these barriers? And really, whose responsibility is it? We can look towards the central principle of policy and service reform in mental health over the past decade. A growing movement suggests that consumer participation and outreach services should be vitally involved in the process. Allowing parents and students to have power and influence on the system and services that affect their lives is critical in recognizing and understanding mental health. But how do we actually measure good mental health? Who spots it? Who responds? And well, whose responsibility is it? Although thinking about the impact of environmental factors and experiences for positive mental health and well-being is important for all children, we know from experience as educators that it will be crucial for some. Students learn best in the context of caring, supportive relationships with their teachers and peers. This is why creating a positive classroom culture is critical. Children who perhaps come from adverse negative experiences are given the right to a calm classroom environment, allowing students to thrive within safe relationships where they can practice self-regulation. So in order to invest in well-being, educators must first understand how setting the classroom for constructive conflict resolution is a priority for students, especially if healthy conflict resolution has not been modelled in the home environment. If we assume that it is the responsibility solely of educators to recognise and respond to mental health, then we must empathise that educators consciously bring an awareness of their own and others' personal experience by understanding that they are shaped by broader inequalities and social structures. This can be achieved by an openness to being reflective about our own assumptions, beliefs, theory, and practice. How do students feel about themselves and one another? How do students communicate with one another? What attitudes and beliefs do students hold towards one another? And how do students handle conflicts with themselves and one another? Approaches to mental health are not a linear one-size-fits-all solution. Rather, ongoing dialogue among schools, consumer groups, service providers, and families are needed to address the question of whose responsibility is it?